Hello, I'm Josh Newman, Physician Assistant with Dr. Brett Taylor, a fellowship-trained, board-certified surgeon at Town Country Crossing Orthopedics. With over 15 years of professional experience in workers' compensation and litigated spine care, Dr. Taylor understands the accuracy and scientific clarity required in these cases. He has created the Taylor Spine Team, which is composed of competent and considerate healthcare providers that are dedicated to providing top-tier spine care to injured individuals. Town & Country Crossing Orthopedics offers precision-based spine care which focuses on the patient as an individual. Dr. Taylor evaluates patients from a variety of backgrounds and cultures. He works closely with patients, spending time thoroughly explaining their treatment options and always giving opportunities to ask questions. New patients will spend significant time with Dr. Taylor, Lori Burke, RN, Workers' Compensation Coordinator, and me. We focus on patient expectations and accountability. Prior to surgery, a timeline is signed by the patient outlining expectations, expected return to work, and maximal medical improvement. Through an evidence and precision-based medicine approach, our work speaks for itself. Thank you for watching. Dr. Taylor will be speaking next on a topic important to us at TCCO.
Hello, I'm Dr. Brett Taylor. Today we'll be talking about lumbar fusion. Lumbar fusion is a surgical procedure to grow two spine bones together, using the patient's own bone or donated bone. Frequently, this surgical procedure is accompanied by the use of hardware, cages, screws, rods, or plates. Fusion is performed for a number of indications, including traumatic injury, instability, or non-union. Another indication for fusion includes stenosis at levels above or below a prior fusion. Fusion is rarely performed for a disc herniation. Spine instability occurs when the spine bones move more than normal, with flexion bending forward or extension bending backwards. This is often due to damage or injury to the supporting structures. To make this diagnosis, special types of imaging or X-rays are required to measure the movement of each vertebrae. In selective cases, recurrent disc herniations can be managed with a spine fusion. Another indication for a spine fusion is a non-union, or a circumstance where the bones fail to grow together. Individuals who have failed fusions, based on X-ray studies, may be candidates for additional surgery. Fusion for back pain can be performed selectively in patients who have had symptoms for months and do not abuse nicotine. If an individual has disabling back pain, they failed aggressive physical therapy, and they have no psychological contraindications to surgery, surgery can then be considered as a last resort. The surgical treatment can be either fusion or disc replacement. Clinical success for back pain surgery is tied to optimal patient selection. After a spine fusion, patients are at increased risk of adjacent segment disease or arthritis that develops above or below their fusion. This is due to both the natural progression of arthritis and the mechanical effects of the fusion, which actually increases the stresses at the levels above or below the fusion. In my practice, standard outcome measures are followed for all spine surgeries. On average, my lumbar fusion patients have significant clinical improvement following fusion, despite 30% being obese and almost 40% using nicotine. Lumbar fusion patients in my practice have less than a 1% infection rate. This is achieved by a number of aseptic techniques. 34% of patients return to work in the light to sedentary demand level, 49% in the medium, and 17% in the heavy to very heavy.
Hi, I'm Alyssa Visconti, Administrator at Town & Country Crossing Orthopedics. In addition to orthopedic spine surgery, Dr. Taylor also offers supplementary services such as IMEs, chart reviews, and case evaluations. New patients as well as IMEs can expect to be seen within 10 business days of request and finalized notes completed within 5 business days. Every effort is made to maximize appointment efficiency. We also offer day of appointment work status reports and immediate accessibility to Dr. Taylor and his staff through numerous channels. At Town & Country Crossing Orthopedics, case managers are welcomed. we offer an inviting case manager lounge. To experience better spine care, contact Town Country Crossing Orthopedics. Watch for our upcoming videos in this 12-part video series, and thank you for watching.